Today we're diving into a literal pain in the neck, one that millions of people experience. For a long time, if it got bad enough, the final answer was surgery. But what if that's not the whole story? A brand new study is making us ask a really tough question. Have we been getting it wrong all this time?
You've probably heard the term pinched nerve. It sounds simple enough, and for many, surgery seems like the ultimate fix. But what if the science is actually telling us something completely different, something a lot more complex? To really get what's at stake here, we first have to understand what this condition really is.
All right, so first things first, let's get on the same page about what we're actually talking about here, because this is a condition that affects a ton of people every single year.
Now, the fancy medical name for it is cervical radiculopathy, but for you and me, it's just a pinched nerve in the neck. Basically, a nerve root right where it leaves your spinal cord gets squeezed or irritated, and, well, it's not happy about it.
So how would you even know you have this? Well, the classic signs are, of course, neck pain, but the real tell is often pain that shoots down your arm. You might also get that weird pins and needles feeling. Doctors call it paresthesia, or you could even notice some weakness in your muscles. It's that nerve basically sending out distress signals all the way down your arm.
And believe me, this is not some rare, obscure condition. To put it into perspective, studies show that every single year, about 107 out of every 100,000 men will deal with this, and that's just one side of the coin.
For women, the number is a little lower, around 64 per 100,000. But when you add all that up, we are talking about a major health issue that affects millions. And you'd think for something so common, we'd have the treatment totally figured out. Turns out, not so much.
And that brings us right to the heart of the matter. The big debate. For a problem this widespread, you'd want a clear, easy path to relief. But for decades, the question of how to best treat it, and especially when to pull the trigger on surgery, has been surprisingly controversial. For years, the standard playbook has been this kind of step-by-step approach. You start with the conservative stuff, right? Physiotherapy, maybe some pain meds or steroid injections to calm things down. Then, if none of that works or your symptoms are just getting really bad, surgery becomes the next logical step on the ladder. And this is the million-dollar question, isn't it? Is that jump to surgery, the most invasive, final option, always the right call?
You might be shocked to hear this, but for such a common operation, the evidence backing it up has been pretty weak. For a long time, the recommendations weren't based on rock-solid science, but more on expert opinion, and what researchers themselves admitted was low-quality evidence. The foundation was a bit shaky. But that is all starting to change. A brand new, high-quality study has just hit the scene, and it was designed specifically to cut through all that uncertainty and bring some real clarity to this debate. To really get why this new study is such a game-changer, you have to see what we were working with before. We only had two small, kind of old trials to go on, and here's the kicker. Neither of them showed a clear win for surgery. This new research from Tasso and his team is different. They ran two super rigorous trials at the same time to get a much clearer picture.
Now, the way they designed this study was just incredibly smart. See, the researchers knew that a pinched nerve isn't always the same problem, so they split people up based on the cause. They ran one trial with 89 patients who had a disc herniation, and a totally separate one with 91 patients where the problem was spondylosis, which is basically age-related wear and tear. In both groups, people were randomly assigned to either get surgery or stick with non-surgical care.
So, after all that careful work, what did they find? Well, the results were, let's just say, pretty surprising, and they could totally reshape how we think about treating this condition.
First off, there's some really good news for pretty much everyone. Across the board, it didn't matter if they had surgery or not, patients in all the groups felt better after a year. This just goes to show what doctors have suspected for a while. The body has a pretty amazing ability to heal, and most people do get better over time.
Okay, so let's dig into the first big result. For the folks whose nerve was being pinched by a disc herniation, surgery did offer a small but real advantage. The difference was what scientists call statistically significant, meaning it probably wasn't just a fluke. But, and this is a big but, the overall benefit was pretty modest.
But now, for the real jaw-dropper. For the second group, the one where the pinched nerve was caused by that wear and tear spondylosis, there was no statistically significant difference between surgery and non-surgical care. I mean, just look at those bars. After 12 months, both groups were doing pretty much equally well. So what does this all mean? What's the big takeaway for doctors and the millions of people who are going to deal with this? What do we do with this new information?
The researchers themselves summed it up perfectly. They said that when you look at these relatively small differences in how people felt, or in some cases no difference at all, you have to weigh that against the very real risks and the costs that always come with surgery.
And that brings us to this incredibly powerful piece of wisdom, which was shared by Dr. Jerome Paquet when he wrote about this study. He quoted one of his mentors who told him, "Any surgeon can operate, but a great surgeon knows when not to do surgery." And this new evidence? It gives those great surgeons a much better tool for knowing exactly that.
So we'll leave you with this thought. This huge study suggests that for a really common, really painful problem, the best tool in the toolbox might not be a scalpel. It might just be patience and wisdom. It's a powerful reminder that in medicine, true healing isn't just about what you can do to fix something, but about having the insight to know when the wisest choice is not to cut it all. Thanks for tuning in.